Hello students, how are you? Hope you all are healthy and wealthy. Okay, you are healthy. Oh, good. If you are healthy, it's too good because everyone wants to be a healthy and happy life. Okay, so to be healthy, you need to be very careful. You need to have some exercises to keep yourself fit, and you have to take some preventions to keep yourself disease free. So, but sometimes it happens when we go in our surroundings, when we go out for playing or for some other works and we go in crowded areas, we may fall sick, or when we come in the contact with the infected person, then also maybe we can catch the infection. So what happens then? That time we need to take some treatment. So today we are going to discuss principles of treatment. Principles of treatment. If we talk about the treatment, then there are generally two ways to treat the infectious diseases. There are two ways. One is symptomatic treatment. Okay, and another is to kill the disease causing microbes, or by kill, or we can say killing disease causing microbes. Okay, so what are symptomatic treatment? In the symptomatic treatment, what happens? Sometimes we suffer from body ache, sometimes we suffer from headache, sometimes there is a toothache, sometimes we feel like vomiting. So do we go to directly to the doctor? No. Generally we go to a chemist to take some medicine, and if we go to chemist, then we tell him, I am suffering from headache, kindly give me the medicine, and then when he give you medicine, then you take it and you feel better. So such kind of treatment is symptomatic treatment. In this symptomatic treatment, generally you take medicine from the chemist on the basis of general symptoms. Okay, that is why it is known as symptomatic treatment. Symptoms. Clear? But sometimes it happens after taking the medicine on the first level, you are not getting relief. Then what happens? You go to doctor, you go to physician to consult. And once you go to doctor, then what he does? He examines you and then he sends you to the laboratory for the test. And once the tests are done, on the basis of reports, he gives you medicine. And what are the medicines? These medicines kill the microbes, and these are antibiotics. Okay, so what is the killing disease causing microbes? Okay, in this we go to doctor and then doctor or physician. Okay, then he sends you for the laboratory test. On the basis of laboratory test, doctor gives you antibiotic. If the disease is caused by bacteria, then he gives you antibiotic. If the disease is caused by bacteria, then he gives you antibiotics. Now, what are these antibiotics? These antibiotics are the chemicals secreted by microorganisms like fungi and bacteria to kill the growth of microorganisms. What are antibiotics? Antibiotics means antibiotics are chemicals secreted by microorganisms to kill the growth of other microorganism. Okay. Clear? So once you consult the doctor, on the basis of your test report, he comes to know ki what kind of disease you have, then he gives you the medicines, and then once you take the antibiotics, you feel better. One more thing, when the doctor prescribe you some medicine, you should take proper dose of it. Otherwise, there are the chances you will get infected once again. Okay? So these are the two ways to treat yourself from a disease. Clear? One is symptomatic treatment, another is killing disease causes microbes. Okay, now as I told you, means prevention is better than cure. You got sick, you got the diseases, you fall sick, you fall ill, then now you are taking cure of that. Okay, but what is that if you do not fall sick? You need some preventions to prevent to prevent yourself from the different diseases. There are the two ways, by general ways or by specific ways. As it is said, prevention is better than cure. Okay, keep the thing in mind ki beside getting false sick, you must take care of yourself so that you do not fall sick or you do not fall ill. So now next topic is principles, or we can say methods of preventions. Our next topic will be ways of prevention of infectious diseases. I told you infectious diseases means communicable diseases which spread from one person to another. Ways of prevention of infectious diseases. Okay. There are two ways, general way and specific way. General ways and specific way or specific treatment. If we talk about the general ways, okay. In general way, first of all, we should take care of sanitization or sanitation. Number one is sanitation. Sanitation means hygiene. Okay, so if we talk about sanitation, means public hygiene is the important key to keep your surroundings clean or to keep yourself disease free. Okay, how do you keep your surroundings clean? First of all, you should throw the garbage in the particular place. You should not throw the garbage in the open places. You should not keep the food for the open. Okay, and you should not take the contaminated food and water. So personal hygiene or sanitation is very important to keep yourself or to prevent yourself from the diseases. Okay. Another, if we talk about, then after the sanitation there is eradication of vectors. Eradication vectors. What are vectors? If we talk about vectors, then vectors may be the agents which spread the diseases from one person to another, which carry the germs of disease from one person to another. So we must eradicate these vectors by using the different methods. As what are the vectors? We know flies, mosquitoes are the main vectors. So we can eradicate them with the different methods. Next, if we talk about, that is isolation. Next is isolation. In isolation, if a person is suffering from a disease, means that person is infected person, so we should isolate that person and we should not enter him in the surroundings, so that we can we can prevent the other persons from this infection. Okay, so isolation, we should keep the person separately, or we should keep that infected person in the isolated form. Another is taking proper food, proper and sufficient food means nutritious food. If we talk about proper and sufficient food means we should take a nutritious diet. We should take protein, vitamins, minerals, okay, carbohydrates, everything in our diet. Even we can say we should have a proper nutritious balanced diet so that we can improve our immunity and we can fight to diseases. Okay, so thus we can prevent ourselves from the diseases by taking proper and sufficient or by taking nutritious diet. Nutritious diet. Clear? Now next is education, means we should aware people, we should educate people about the awareness, we should aware the people about the diseases, how they spread and what are the preventions, how can we keep ourselves safe from the diseases. So another important point is education. We must aware people, we must aware the people in our surroundings to prevent themselves from the diseases. What should they do and what should they do not, they should not do. Okay. So this is the education, means to make people aware. Okay, if we talk about specific ways, children, if we talk about smallpox, hope you all know about that. Before, if we talk about more than 100 years ago, it was very dangerous and it was the disease which we can say ki people were very afraid of it. Okay, so why they were afraid of it? They were afraid because they thought, they were thinking if they will go in the contact with that person, then they will also be affected by it and they will catch the disease. And but now these days the scene is totally changed. Why? Because smallpox disease is totally eradicated from the society. Why it happened? How it happened? It has been happened by the vaccination. Okay, so specific way is taking vaccination, proper vaccination. Now what are vaccines? Vaccines, if we talk about the vaccines, then vaccines are the agents. Okay, what is vaccine? If we talk about the vaccine, then vaccines are inactive pathogens. Vaccines are inactive pathogens which are injected in the human body. Vaccines are inactive pathogens which are injected in the human body or in the body, or we can say in the living organism. Okay, once the vaccine is injected, then it develops the immunity, and if the disease attacks for the second time, then the immunity fights against it more effectively. Okay, now we will talk about the viral diseases. Okay, now we will study about the common microbial diseases and their prevention. Common microbial diseases and their prevention. Okay, So topic of our discussion is common microbial diseases and their prevention. In this topic, we will discuss about their transmission, okay, and symptoms, control, okay, and prevention. First of all, we will discuss about the viral diseases. Viral diseases means they easily spread, okay. So common viral diseases are hepatitis, polio, rabies, AIDS. AIDS means acquired immunodeficiency syndrome, okay. So common, if we talk about the viral diseases, then common viral diseases are hepatitis, okay, polio, rabies, AIDS. AIDS means acquired immunodeficiency syndrome. Clear? AIDS full form is acquired immunodeficiency syndrome. Now first of all, we will talk about hepatitis. Hepatitis, if we talk about hepatitis, then hepatitis is the worldwide spreading disease, or we can say it is worldwide communicable disease. Number one is hepatitis. Okay, first of all, we will discuss about it. Hepatitis. Okay, if we talk about hepatitis, then what kind of disease it is? It affects the liver cells. It damages the liver cells. Once the hepatitis virus enters in the body, okay, then it damages the liver cells and then causes jaundice. So let's talk about hepatitis. Is a worldwide communicable disease. It affects liver. Okay, so we can say this is the disease which affect the liver. If we talk about types, then types of hepatitis are hepatitis A, hepatitis A, generally known as infectious hepatitis or infectious disease, also known as infectious hepatitis. Okay, hepatitis B, also known as serum hepatitis, Okay, then hepatitis C, hepatitis D and hepatitis E. Another is, after this, hepatitis C, hepatitis D and hepatitis E. So what are the types of hepatitis? Hepatitis A, also known as infectious hepatitis, hepatitis B, also known as serum hepatitis, hepatitis C, hepatitis D and hepatitis E. Okay. So how does it occur? What happens, children? Generally it is caused by the hepatitis virus. It is caused by hepatitis virus. Okay. Once the hepatitis virus enters in the body, then it goes to the liver and damages liver cells. Then bile pigment, bilirubin, secretes from these damaged liver cells, and then it get deposited in the sclera. And sclera, what is sclera? Sclera is the white part of the eye, and get deposited in other parts of the body, and then it causes jaundice. Okay. How does it occurs? Then we can say hepatitis virus damages liver cells, and from the liver cells bilirubin, we can say bile pigment is released or secreted. Bilirubin, that is bile pigment, is released from damaged liver cells, and then it goes to the sclera. It goes to the sclera. What is sclera? Sclera is the white part of the eye. Sclera is white part of eye. It get deposited there, and then it causes jaundice. It causes jaundice. This is the disease caused by hepatitis virus. So you can answer if someone asks you which disease is caused by hepatitis, then jaundice is caused by hepatitis virus. Okay. What happens in jaundice? In jaundice, body means skin color changes. It becomes yellowish. Okay. And next is, after this we will talk about the mode of transmission. Next is mode of transmission. What is the mode of transmission of hepatitis virus? Then hepatitis A is, if we talk about the hepatitis A, then hepatitis A spreads through contaminated food or water. Even hepatitis B is caused by the contact with the infected person. Okay. Hepatitis A Hepatitis A is caused by contaminated food and water, and hepatitis B. If we talk about hepatitis B, then it is caused by the contact with the infected person. Is caused by the contact with infected person. Okay. Now next we will talk about the symptoms. Next is symptoms. What are the symptoms of hepatitis? Then as I told you, it causes jaundice and body color changes, means skin becomes yellow, eye part sclera becomes yellow. Okay, so What are the symptoms? We talk about the symptoms of hepatitis. First of all, fever and loss of appetite. Person feels feverish and diet becomes less, loss of appetite. Okay. Nausea or vomiting. Dark yellow skin or yellow skin. Body ache or joints pain. Urine color changes. Okay, so urine becomes dark yellow, colored urine. And light color stools. Light colored stool. And you can feel this symptom after 3 to 10 days of infection. After 3 to 10th day of infection. Clear? So, these are the symptoms of hepatitis. Once person get affected by it, he feels feverish, he loses the diet. Okay, nausea or vomiting, yellow skin, joint pain, dark yellow color, urine and light color stool after 3 to 10 days of infection. Yellow skin means it causes jaundice. As I told you, when bilirubin secretes from the damaged cells of liver, then it gets deposited in the sclera. Sclera is the white part of the eye, and then it causes jaundice. Okay. Now we will talk about the control of this disease. If we talk about the control, how can you control it? So, as we know, it is a viral disease, so one should take care of himself and he should take proper rest. Okay, complete bed rest, diet rich in carbohydrate, rich diet. Okay, and he should limit it, or he should take less amount of proteins and fat, or we can say limited intake of protein or fat, protein and fat. Okay. So, how to control hepatitis? One should take complete rest, he should take carbohydrate rich diet and limited intake of proteins and fats. Okay. Now, what are the preventions? We will discuss the preventions. First of all, as I told you, personal hygiene is the main prevention of diseases. You must take proper hygiene to take care of yourself to prevent the diseases. So, if we talk about the prevention, of hepatitis, then one should take proper hygienic food. proper eating of hygienic food and drinking of uncontaminated water, or we can say disinfected water. To make the water uncontaminated, we should add disinfectant to it. So, we should take hygienic food and drinking of disinfected food to prevent the hepatitis. Next, one should using disposable syringe. Okay, means once you use any syringe for vaccination, then you must throw it and you must dispose it. So, using of disposable syringes, then proper cleaning. As I told you, proper hygiene means proper cleaning, means we should wash the hands time to time and by using soap and other disinfectants. Okay, and after using the different objects, we should clean them. Proper cleaning of hands with soap or disinfectants. Okay. So, this is the hepatitis disease. How does it spread? Okay, what are the types of hepatitis? How does it spread? How can we control it? What are the symptoms? How can we control it and how can we prevent it?